From CareCredit, it's Care Experts, a podcast where we dive deep into the health and pet care industry with the professionals that make it happen. I'm Antonio Diaz, and this is Logan. This episode is brought to you in partnership with Embrace Pet Insurance. Today, we're joined by Dr. Courtney Campbell, board-certified veterinary surgeon and founder of Stitches, a veterinary surgery center in Long Beach, California. Dr. Campbell will walk us through step-by-step how to prepare for pet surgery, support our pets through recovery, and he'll share some incredible healing stories that showcase just how amazing our pets can be. Dr. Campbell, it's so great to have you.
Yeah, it's great to be here.
You are a board-certified surgeon. Let's jump into surgeries. Sure. How can people best prepare themselves and their dogs for surgery?
It can be an overwhelming moment, right? It can be an overwhelming moment for a lot of pet parents. And I always tell them, like, the mental preparation is just as important as the physical preparation, right?
Imagine, yeah.
And if you're feeling nervous, right? If you're feeling a sense of anxiety, lean into that just a little bit, because those nerves are letting you know you're about to do something important. And so I always ask them to lean into that. But knowledge is key. And so the most important thing to remember is that you are not alone, right? That's the most important thing for pet parents to remember. You are not alone. Remember, this is a partnership, right? The pre-surgical journey starts way before your pet even gets into the OR, right? So it starts before, during, and will continue long after, right? So instead of thinking it as a medical procedure, right? Think about it as a journey.
Now, what common surgeries do you perform? Because I know the term surgery is pretty broad.
It is,
so
yeah.
More, because that can pretty much be a wide range of things.
Right.
So what are you commonly in surgery for with dogs?
Yes, certainly. This is so important because a lot of times you have a family who says, well, what's the point of a board-certified veterinary surgeon? My veterinarian locally, he does a lot of surgeries. Isn't that just as, why would I ever need to see a veterinary surgeon? And the reality is the complex cases, right? So your local veterinarian is really focused on wellness and really focused on giving pets a better quality of life through very primary procedures, whether it be a spay or a neuter or mass removal or something like that. Now, for a complex fracture or a broken bone or a torn ligament or a massive tumor, that's when you're going to need more specialized service. Now, there's a lot of very talented primary care veterinarians out there, but they may refer those cases to specialists or surgeons because surgeons typically may have advanced equipment.
Yep.
They may have additional expertise, or they may be able to do the procedure quicker and more efficiently and more precisely, right?
I see.
And so it's all about precision and compassion. And so those are the types of cases that we see. So I personally do a lot of soft tissue surgery, so things like intestinal surgery, liver surgery, spleen surgery, and of course, 70% of what I do is about orthopedics, fractured bones, torn ligaments, twisted bones, those sorts of things, bones that dislocate. Those are the kinds of surgeries we tackle. And of course, cancer surgery as well, right? We know that a high percentage of dogs who are over the age of 10 will have cancer at some point, and surgery is going to be one of those options that they may have.
Okay, and what kind of questions should a pet parent ask someone like yourself before surgery? Yeah,
knowledge is power, right?
Amen.
Knowledge is power. And I always talk to pet parents and I say, change it from wait to advocate, right? Instead of waiting for the procedure, advocate on behalf of your pet by asking key questions. Number one, why do you think this surgical procedure is ideal for my pet, right? As an individual. Second, what complications could my pet experience from this procedure, right? Because there is no procedure that is absent the risk of potential complications, right? We hope they all go well, but we know that this is surgery.
Yeah.
Number three, what's the recovery timeline? Meaning, what are you going to expect from me at home to take care of my pet? Remember, this is a partnership, right? This is a partnership between you and your pet's medical team. And so what to expect from me? What are the pain management protocols that you have in place, right? That's really key. So many pet parents are so diligent and they care so much about pain management, which is so beautiful because remember, they're not the ones feeling the pain, right? But they advocate on behalf of their pet so that they're not in pain. And finally, who's the point of contact, right? If there's something going wrong, Who can I call? Who can I send a text message to, or a video or an email, so that I can send it to you at, I got a mess. I wouldn't advocate for all pet parents to do this, but I got a text message at 3 a.m. By a pet parent saying, "Hey, Courtney, what's going on here?" And I don't know how miraculously I woke up from a deep slumber, but here I am texting at 3 a.m. My point is this, is that those would be the questions. Why is this the best surgery? What potential complications? What's the recovery timeline? What pain management? And, who should I call? Who's my point of contact? There are a lot of people who believe asking about the experience level of the surgeon is important. Well, doc, how many of these have you done, right? That's the question of the day.
Yeah.
But keep in mind, some procedures are pretty uncommon, and every pet is an individual. So you might say, well, how many of these tumors have you done? Well, I've done a lot of tumors, but this particular one is unique to your pet, and the configuration is very different. So it's not necessarily about how many of that specific procedure the veterinarian's done. It's just the collective experience overall.
I like the way you put that. If someone is getting prepared to bring their pet into surgery, what are some things that you'd recommend that they do? And I'll even like to add and say not do, because I'm thinking, like, when my Shepherd had her CCL injury, I was thinking, not that I would have done this, but I'm thinking, okay, well, if she's going to go into surgery, maybe a couple of days before I can throw her frisbee, because I know she really wants to, and I haven't been able to do that with her because what the heck, she's going to go into surgery now, so she'll be all good to go. Right. So would you recommend somebody not indulge in some of those practices prior to surgery, and what would you recommend that they do?
Take your pet off of supplements according to the instructions of your veterinarian and your veterinary surgeon. They may say, we'd like you to stop these particular supplements. So those are the do nots. But let's talk about some do's. And what I like to talk about them is called pre-surgical practice, right? Number one, practice a routine, right? If you know that your pet is going to need care twice in the morning and in the evening after surgery, then establish a routine. Walk them, at the same time in the morning, in the evening. Play with them, same time in the evening, right? Water, same time in the morning and the evening. That's practice. Second thing is practice crate training, right? That's so key. Crates are by far the number one most important tool to help prevent overactive pets, or to help prevent excessive activity after surgery. Number 3, practice cone wearing, right? Because for a lot of pets and for a lot of pet parents, the very first time they have to wear the cone or the Elizabethan collar, the e-collar, is immediately after surgery. And now you're dealing with new medications, a cone collar, they're recovering from surgery. There's a lot going on there. Yeah. So if you can, see if you can get that cone collar early and put it on for short periods of time to see how your pet interacts. Maybe the third thing to practice is medications. Practice how to give your pet medications, because now you have this Ziploc bag full of medications you need to give your pet, and this is the first time you're ever doing it. Yeah. That can be anxiety ridden. So get a bag of frozen peas. Use a frozen pea as a mock tablet, as a mock pill, and hide it in something. And then practice giving your pet that particular medication, but in this case, it's a frozen pea. Yeah. So practice the cone collar, practice crate training, practice a routine, practice the medications, and I think those will be some of the major keys to preparing before surgery.
You are absolutely speaking my language. When you said crate training, I lit up inside. I'm like, thank you. I almost want you to say it a couple more times.
I saw you almost jump out of your chair.
Well, because people get so offended by the idea of putting their dog in a crate, and I try to explain from my perspective that it doesn't have to be a negative thing, and we're not putting them in jail, they're not in trouble, but it can be a very beneficial thing, especially for a dog who just came out of surgery who needs to be immobilized in a sense. And the desensitization protocol that you mentioned with, collar conditioning and getting them used to getting a pill, it can be very off-putting for a dog when somebody grabs something and they walk up to them like, hey, I got this thing you got to take, and the dog is looking at them like, what are you doing? You never approached me like this before. So conditioning them to that and desensitizing them prior is just like that's I'm about that. So
absolutely.
I love that you said that.
I used to have a phrase called "no crate, no surgery date," because I remember talking with a family. The dog's name was Tyler, and exuberant lab. I mean, overactive. Well, I say overactive lab. I think he was just being a lab, right? And family member told me that they They got the crate for after the surgery. So we do the orthopedic surgery, fix his leg, and he's back at home. And I call him, hey, how are things going? How's the recovery going? Oh, it's impossible. It's been a nightmare. We can't control him and he's running everywhere. I said, what about that crate that you had mentioned? Oh, doc, we never really got it. Oh, you never got it? So then I said to myself, you know what? We're not scheduling a surgery date until you take a picture of the crate that you have at home. I've softened on that position a little bit, but I would say this, that no crate, no surgery date is still something that rings through in my mind as to how important it is to help control overactive pets. And I love what you said about the crate not being jail. Of course, if you want to come out and just hang out and Netflix it out with your pet, just keep them on a leash and keep them close to you, right? Yep. And now you're interacting. But if they're not being supervised, they got to go in the crate. Now, I know what some pet parents might be thinking. You know what? I don't need a crate. I have baby gates. But I have heard about families who set up the baby gates. They go down the street just to grab, something from the store. They come back and the dog greets them at the door. And they're like, how did you get over those baby gates? Now they got to check the cameras and everything. So my point is, crates by far are the most effective means of controlling activity.
Yeah, and I love that you mentioned a leash, because that's another thought that I had, is that, even when the dog is out of the crate, there's still a lot of potential for them to move around in ways that they shouldn't. So a leash, and I always tell my clients, I'm like, a leash isn't just for walks. It's for having the ability to physically control your dog and limit them wandering around the house. And in my case, it's usually for issues like potty training or the dog's getting into things, chewing on things they shouldn't. Yeah. But a leash is a great tool to use too, in conjunction with a crate when they're out of it.
Right.
So let's talk about during surgery.
Yeah, certainly.
So what does that look like for both the pet and for the pet parent?
During surgery, that is so important, because when you start and you enter, it's the day of surgery, right? You're getting out of the car, you're bringing your pet in. There might be a little bit of a whirlwind of activity, and you just need to be expecting that, right? There might be a consent form to sign. There might be, if anybody has read a book called A Checklist Manifesto, outstanding. And there might be a checklist, and just allow, when you come in and drop your pet off for surgery, just allow the veterinary professional to do their checklist, right? They might give your pet a medication to calm them down again, so that it's a good experience. Then they'll place an IV to get some fluids. They might do a little shaving preparation. It's kind of like a little bit of a beehive. Everybody's got their role. Everybody's moving around, and that's what it looks like in the back. But they're going to call you before the surgery. If there's anything, keep your cell phone on, because there might be something that happens during the surgery. They need to get you on the phone. And then they're going to call you after the surgery as well. And so that is that's critical to remember. So the day of surgery is drop off, do your consent forms, your checklist, the sedation. There might be some pre-surgery medications the vet prescribes, saying before you drop your pet off or before you bring your pet in for surgery, give these medications, right? That's key. Follow those recommendations, and then they're going to call you a bunch. But the reunion is the best part, right? Is the best part right after surgery, bringing them out from the bag and then seeing the family in the lobby, and they just boom, it's like a magnet. They come together. That's a wonderful thing.
Yeah. Do you have to tell people to tone it down a little bit?
Absolutely. Because to your point, the energies, right?
Yeah.
If your pet is groggy, just came out of surgery, is kind of disoriented, and you're just expecting Fluffy to be the same, it's not going to be the same.
Is it typical for dogs to have to fast prior to surgery?
100%, right? So food after midnight is, no food after midnight is a typical recommendation, but water is okay, because water typically leaves the stomach in about 20 minutes. And if you withhold water at night, then your pet showing up for surgery is going to be dehydrated, and we don't want that. So I would say no food after midnight is just a very general recommendation. There's some nuances there, as you imagine. And then, of course, water is okay.
Okay. Yeah. Let's talk about post-surgery and the recovery process. What does that typically look like for the pets that you perform surgery on, and how difficult is it for people to maintain the guidelines that you provided them for their pets?
Yeah, by far, without question, the most important thing that pet parents can do in the post-operative period and the post-recovery process is just adhere to the guidelines.
Thank you.
Right?
I was waiting
You've
for you
had
to say
post-op recommendations, medications. If you just stick to those, right? Even though it may be challenging, I can't tell you how many families I talk to and I say, hey, your dog just had orthopedic surgery on the back leg. So we need to support their back of their body using a sling, which looks like just, a U-shaped sling that helps to provide support. They'll come in, no sling. Or I'll say, hey, listen, your dog just had an incision. They do need a cone to prevent them from licking at the incision. They'll come in, no cone. So what I would say is, if you can, see if you can adhere to some of the guidelines and give the medications as prescribed. If there's any concern or if you're worried, give your vet a call and say, hey, listen, I think this dose is too high, or I think this dose is too low, or this makes my pet feel this way. Is there something we can do for that? But don't just not give it, right?
Yeah.
Because then we might be expecting something that's just not happening. So I would say post-surgery, your pet may be groggy. Your pet may have a low appetite. Your pet may be disoriented. They may not feel quite like a dog for about 24 to 48 hours, but give them time. And then if you have any questions, just read those instructions that your vet gave you and see if you can follow those.
Yeah, I can definitely see people struggling with guidelines, especially if they're looking at their dog and like, well, they seem to be doing pretty good today. Maybe we can just let them run around a little bit.
Right.
You ever find that, though, that's like a struggle for people to, let's say, taper back on some of the exercise or whatever the requirements are for their dog?
Right. They almost feel like let dogs be dogs.
Yeah.
And we have to emphasize that, if it was me or you, we would be in maybe a wheelchair on crutches, or we'd be nursing the injury for months. But in pet parents, sometimes they may not give their dogs the same grace or the same level of patience.
Yeah.
And they say, well, they look like they're doing okay. The bone must be fine now. Let's let them recover like normal. Now, keep in mind, just because they're acting okay, that doesn't mean they are, right?
Yeah.
You have to be an advocate for them. You have to think for them that they're not quite yet recovered.
That's so interesting. Now, you've helped thousands of pets overcome surgery and give them better lives. I would love for you to share a story that kind of rings a little warmness in your heart and tell me a little bit about something you've experienced with the dog that you've helped.
Oh, I mean, yeah, you're right. It's. I think when it comes to this kind of topic, right, where you and I are talking about dogs that we've helped, right? It's not that we have challenges with a story. There's too many stories, right? And I think you probably feel exactly the same. But yeah, it's challenging to pick out one, but I could certainly say that one comes to mind is a dog named Bolt, right? It was a dog. This dog could have been like a national champion, right? Athletics, and just an agility dog, just outstanding. Eventually retired from agility and was with a family, and that family would notice Bolt just didn't have the level of explosive power. And then all of a sudden started to see a front leg lameness. And every day that lameness just got worse. The limp got worse. And you'd see a head bob with that lameness because Bolt was trying to take weight off of the leg because it hurt so much.
Yeah.
We ended up taking an x-ray. We saw there might be a problem with the elbow. So we put a camera in the elbow, or arthroscopic surgery, and we found a huge cartilage fragment that had cracked off inside the elbow. And just the ability to do a tiny camera and put another little grasper inside and pull out that cartilage fragment where Bolt no longer felt like there was a pebble in the shoe every time he took a step, right? That stabbing pain. He was back to being his same athletic self, explosive, catching frisbees through the air, which really gets to me at the heart of the human-animal bond, right? I personally, for some reason, love to watch dogs eat. I think it's amazing just how incredible they're just so happy when they're eating. There are people who like to see dogs fly through the air and catch frisbees, right? But it comes down to just that human-animal bond. And I was able to restore that human-animal bond using minimally invasive techniques, having Bolt recover faster, take out that cartilage fragment, and give an athletic dog back his life again. I just found that so touching.
Yeah, I'm imagining a border collie.
Yes.
Was it a border collie?
Yeah, it was a border collie mix. I'll say that. It was a border collie mix. But from looks like a dog, walks like a border collie is a border collie, right?
Have you ever had a case where a pet exceeded all expectations? Maybe they were it was a risky surgery and you weren't quite sure, and then they just recovered above and beyond what you expected?
Oh, absolutely. Absolutely. There are dogs. Mother Nature's amazing. Mother Nature's amazing, specifically in cats too. Cats can be challenging at times because they don't take kindly to orthopedic surgery.
Yeah.
But sometimes you might see a cat who has an orthopedic injury. Maybe they broke their hip, a pelvic fracture. And you're like, I don't know. This poor cat got hit by a car, right? That's so challenging. Multiple pelvic fractures. You fix the fractures. They relax in their crate for 2 or 3 weeks. And next thing you know, they're back jumping on countertops, being mischievous and just causing a complete havoc or ruckus. So I've just seen dogs recover amazingly, cats recover amazingly. Particularly, though, I will say this. that partnership has to be ironclad. That partnership between you and the veterinary team has to be solid. And early intervention, right? We talked about this, right?
Yep.
We talked about this. If you have a dog who has an injury and you come to me after 6 months or 8 months, that's challenging, right? But if you come to me after a couple weeks or even a couple days, that dog has the best chance of recovering and, as you say, exceeding expectations.
Yeah, it makes perfect sense.
Yeah.
So we know that pets can hide pain, and they do a really good job at doing that, and they can be really resilient. Do you find that to be the case, that pets have a really strong will to recover and are resilient through this whole surgical process?
Yeah, every moment of resilience touches my heart. Every moment of resilience touches my heart, particularly in those dogs who have a high drive. Yes, that can be nerve-wracking immediately after a surgery because you want them to be calm, right? But that drive later on turns out to be such a benefit because they want to move. They want to rehab. They want to get moving again. Now, let's talk about the flip side, though. We got to talk about the flip side. If I'm treating a St. Bernard or a Leonberger or, a Basset Hound, some of these dogs nothing would make them happier than being on the couch and eating treats all day, right? Let's be honest about it. And so those dogs, they are resilient too, but they're more resilient in terms of, I would like to be on the couch and eating treats. I don't necessarily want to be moving. That can be a little bit challenging with rehab. So most importantly, know your dog's personality. I try to focus on the breed personality and the individual characteristics of that particular dog because it's not all the same.
Yeah, again, you're talking my language for sure, because I tell people all the time, I address dogs based on personality.
Right.
Breed plays a role for me, but it's more about the personality of the dog.
Right.
And some dogs are just the most difficult dogs for me to work with, train, and work with behaviorally are going to be the lazier type dogs, because it's really hard to kind of get a dog to do something if they don't want to do it, versus it's so much easier to work with a motivated dog that's really gung-ho, wants to do everything, because we have drive and we can now just focus that drive on where we want it.
Of course.
Versus like trying to build drive in a dog that really doesn't want to do anything and just want to lay on a couch and get some free food.
Yeah, absolutely. You work with them and you find creative ways to get them to move it again.
Yeah. Well, I've been enjoying this conversation. It's time to jump into our Ask Me Anything section,
the
AMAs.
It's like the lightning round.
Yeah, exactly.
Yes.
Yeah. Ready to roll?
Yeah,
All right, let's do
this.
it. All right. So my cat Bernice had surgery 3 days ago and is hiding under my bed. She's still eating and drinking, but won't come out. Is this normal recovery behavior, or should I be concerned?
I would say for a kitty cat who's hiding under the bed, that is normal behavior, particularly after a traumatic experience, right? And so, my heart goes out to that family because they're wondering, I don't want my cat to be distressed, and I want them to have a good experience after that surgery. And I would certainly say, don't force your cat out from under the bed. Create a nice, comfortable scenario for them where food is accessible, water is easily accessible, their litter box is very accessible. Keep things in there that they enjoy, whether it be their special bed, whether it be a special blanket. Again, coax them out gently with either treats or things that they enjoy, but then keep a very watchful eye over them, right? If they're vomiting, if they have diarrhea, if they haven't moved from that position for a very long time. These are all things that I think are critical to keep a watchful eye, but giving them 24, 48 hours to feel like a cat again, to acclimate after that experience, I think is totally appropriate.
Yeah, love that answer. All right, next question. My vet says my dog will need 8 weeks of restricted activity post-surgery.
Right.
How on earth do I keep a 2-year-old lab calm for that long?
Oh my goodness. They've got a journey ahead of them, don't they? 2-year-old lab, prime of their life, and you've got to keep them calm for 8 weeks. It's almost like we're asking the impossible. But this is where we talk about practice, right? Pre-surgical practice, getting them used to that crate confinement, getting them used to that routine, using positive reinforcement to say, hey, when the crate comes out, good things happen in the crate, right? If they have their interactive toy, maybe it's a toy stuffed with some treats, let's say it's peanut butter and they have to work to get it out, or it's a puzzle toy. A lot of dogs will look at their crate as a den, right? And that's where they want to relax. And so sometimes you'll just find them, if you just put the crate in the middle of the living room and keep the door open, you'll just find they go in there miraculously. And that's a good practice for post-surgery. Second, let's be honest, we want this to go well. A lot of pet parents are like, I don't want to medicate my pet. I don't want to give a lot of medications. And I understand that. But just keep in mind, it's finite. This is not going to be a long-term thing, and those medications can really help protect a delicate surgery.
Yeah, that's a great perspective. I would say I fall into that category. I prefer for my dogs not to be on medication, especially if they don't need it long term. So I definitely can appreciate that.
One thing that really makes all of us, our heart jump into our throat, is if you've just done a surgery, there's an emotional commitment there, there's a financial commitment, and the last thing I want your dog doing when he hears a knock by the postman is flying off the stairs. So if sedative medications are going to help prevent me from having to redo the whole surgery or have your dog not experience unnecessary pain and suffering because we have to redo the surgery, I would much rather medications than have to redo the surgery.
Yeah, agreed. Got to look at the bigger picture.
Bigger
in that
picture.
Sense. Yep. All right, last question. We have a blue ragdoll cat, and she has beautiful fur. I really don't want it to be shaved during her surgery. Is that possible?
Yeah. Well, ragdolls are beautiful cats, right? And when you see a picture of ragdoll, you're like, oh, how can we take this fur off? But here's the reality. Some shaving will have to happen. Some shaving will have to happen for a variety of reasons. Number one, sterility, right? Everything needs to be done safely, compassionately, and sterilely. Two, visibility. We need to see what we're doing. And then three, draping, right? When we get into surgery, we use these drapes. And if there's hair everywhere, we can't. The good news is this: hair grows back, but a sterile surgery that doesn't have infection and complications, that's priceless. Yeah.
Dr. Campbell, it's not too often that I have a conversation with someone in veterinary medicine that is so in line and in tune with training approaches in their practice. And I can say I really appreciate the conversation and all the insight that you provided. It's like looking in a mirror, talking to another trainer. It's really been so insightful. So thank you so much for your time and expertise.
Yeah, this has been fantastic. I appreciate the conversation so much.
Yeah. Thanks again to Dr. Courtney Campbell for joining us on Care Experts. This episode is brought to you in partnership with Embrace Pet Insurance, dedicated to providing peace of mind to pet parents with easy to understand insurance plans and 24/7 telehealth support. Hey everybody, if you like what you heard, give us a 5-star rating and don't forget to subscribe and follow on your favorite podcast platform. New episodes drop every Wednesday, so don't miss it.
For information and entertainment purposes only, not to be construed as medical advice. Consult your provider. The CareCredit credit card is subject to credit approval. The information, opinions, and recommendations expressed in the episode are for informational purposes only. Information has been obtained from sources generally believed to be reliable. However, because of the possibility of human or mechanical error by our sources or any other, Synchrony and any of its affiliates, including CareCredit, collectively Synchrony, does not provide any warranty as to the accuracy, adequacy, or completeness of any information for its intended purpose, or any results obtained from the use of such information. All statements and opinions are the sole opinions of the doctor being interviewed. The data presented in the episode was current as of publication. Please consult with your individual advisors with respect to any information presented. All products, services, and company names are the trademarks of their original owners. The use of any trade name or trademark is for identification and reference only, and does not imply any endorsement, sponsorship, or affiliation by or with the trademark holder of their brand.